Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert, and today I am here with my phoneless co-host, Dr. Millicent Rovelo. How are you without your phone?
I am terrified. This is also the first episode that we are not using headphones. So not only do I not have my phone, I don't have headphones on. So I'm feeling incredibly exposed and vulnerable. Like I'm in a really kind of scary place.
You're phoneless.
Right now. I'm phoneless.
I know.
And headphoneless.
It's all that all at one time. I know. Sean just, comes in here. No more headphones, people. Good luck.
But my hair and
what about like the flyaway thing?
I know it's we're gonna get through it though.
All right.
Somehow.
We will get your phone back, I promise.
Thank you.
We know where it is. We've identified the perpetrators of this awful crime. Today...
Ooh, what are we talking about?
I know. Well, and then also Dr. Rovelo goes, why don't you just surprise me with the topic? I said, because people always ask us, oh, who writes your scripts? Like, who does all the writing for you guys? I'm like, we just kind of do it.
Yeah, I kind of spitball it. So we had a list and I said, I don't know, surprise me. Tell me what we're talking. Tell me, doctor, what are we talking about today?
Chin implants.
Oh, okay. All right. Yeah.
And I'll tell you why.
Okay. I didn't see that coming, but okay, I like it.
That's right.
I'm into it.
So that worked. Surprise.
Yay, surprise.
Chin implants are often thought of in a lot of other operations. They come up. It comes up in facelifts. It comes up with rhinoplasty very frequently.
Yes.
Comes up with facial alteration surgery, whether you're doing for transgender patients, for all kinds of craniofacial.
Issues.
So chin implants versus a sliding genioplasty.
Ooh, so sexy.
That's a big term. Where you actually cut the bone, move it, and then put plates to hold it in place, and you don't use an alloplastic material. You don't use a synthetic material, such as...
You're throwing around a lot of big words. Let's take it down to some basics for the folks.
Look.
I know you're
you
fancy
asked me to surprise you,
doctor.
And this is how this goes. This is what happens. Throw it out there. Here it comes.
All right. Well, let's reel it back in a little bit.
So what
is a chin implant? At its most generic basicness, what is a chin implant?
Chin implant is a device, a medical device that is placed either through an incision under the chin in the what's called the submental region, kind of underneath the chin, or through the
lip,
the gums, the inside of the lip, and it's placed along the border of the mandible, which is where your chin, and it enhances the volume of the chin. It can make the chin longer. It can push it out in space. It can make your whole jaw wider. There's a lot it can do. You can get a wraparound that goes all the way to the borders of the jaw. But it's basically it's an implant that is designed to make the chin bigger, period.
And what is it made of?
It can be made of multiple materials. It can be made of silicone, which is my go-to. Yeah. That's what I do. It can be made of PTFE, Teflon, basically. It's also known as a trade name of MedPore, no financial interest here. It can also be made of Gore-Tex. Those are all materials that...
Synthetic, permanent, inert materials.
They are inert. They can be there for the rest of your life. And they're fairly simple to place. There's some nuance to the procedure, which we'll talk about, versus doing a sliding genioplasty, which is typically done by making a gum incision, peeling down the soft tissues off of the mandible off and cutting across the mandible with a saw, the chin, and bringing it forward and then putting plates to hold it in position. These are all really good ways to enhance the look of the chin and make it bigger, and you can make it longer. You can push it out in space. You can volumize the way that the chin, the soft tissue sit. There's a lot of things you can do. There's a lot of flexibility. But today I'd like to focus on chin implants.
Yeah, and so the person that typically comes in for a chin implant, sometimes they know who they are. Sometimes they come in specifically and say, I want a chin implant or a chin augmentation. But sometimes they don't actually know what it is that they need. They just come in and they say things like, I think I have a weak chin, or I don't like my profile. And then they kind of look to us for guidance. So there are a couple reasons why someone might come in. And usually it has to do with they don't like something about how their chin looks. Either they think that it sits back too far, like it's a receded chin. They want it to project out more, or it's too small, too narrow. And so they want to do something to augment it. And they can recognize, even if maybe they can't vocalize, that something about their chin is causing their face to be asymmetric. Like the face is supposed to have sort of a symmetry in terms of how it's broken up from the height. The forehead and the midface and the chin should all be of similar heights. And so if the chin is substantially smaller, the face is in disharmony. And that's usually what people can recognize. And all of the options you gave are great. Like you said, we're talking about chin implants today. And I think we should talk about just briefly chin implants in the presence or instead of a rhinoplasty. Because as you alluded to, these two things frequently go hand in hand.
Yeah, I mean, a lot of when I was coming up through the aesthetic surgery ranks as a young resident, chin implants were talked about as almost like part of the rhinoplasty. And I think to a large part, they still are. There's a lot of patients that their rhinoplasty really benefits from augmenting the chin so that it balances. But I'll get to the pitfalls of chin implants in a bit.
But some people come in and say they think their nose projects too far. But when you look at them in profile, it's really that their chin doesn't project far enough. And so they might be someone that would benefit actually from just a chin implant, and maybe they don't need a rhinoplasty.
Correct, if they're trying to balance their profile.
Right.
So first of all, the reasons you get a chin implant is the chin is, there's retrognathia, which is that the chin is back in the profile, and then there's microgenia or micrognathia, where the chin is small. So those are the big fancy terms. Speaking of $5 words, that's kind of what gets people in. As the rhinoplasty or facelift surgeon is analyzing the face, it behooves them to note whether or not there would be benefit from augmenting the chin. And a lot of times, like I'll see, this is just an aside with the rhinoplasty thing, I'll see a consultation where the patient has seen some other rhinoplasty surgeons and now they've come in for their consult with me and they're going to see, 3, 4 people. And they'll say, well, 2 of the other surgeons thought I needed a chin implant. And it's usually like some 17, 16-year-old teenage, female. And yeah, their chin is small. The chin may be back a little bit. But what I've seen is like that's okay in a lot of cases. It is.
Especially in a female.
Because one thing that I don't like about chin implants, and there's a lot I love about them, which we'll talk about, but I don't like that they kind of masculinize a very feminine face. And so picking the right implant is a huge part of doing a great job with chin implants. And there are all kinds of shapes and sizes of chin implants. So there isn't one size fits all. Everybody needs a custom analysis and a custom job to make it look awesome. And this again, there is no substitute for experience. This is where, having done as many of these as I have, I look back and people say, how did you know not to put a chin implant? Because they do look better that way. It's like, you just know what kind of nose that you're trying to get and what kind of look the patient wants and how the other parts of their face balance or don't balance. And you realize that, this is a patient that'll really benefit from a chin implant. Just did one last week, saw her back today. It looks great. I'm thrilled with it. And then there are others that, you go, no, I shouldn't do that. And they say, well, I'm going to go. This other guy thinks I need a chin implant. And they come back and say, can you pop this thing out for me? Because it does. It just makes them look kind of like a little too hard.
Right. But in the right person, as you mentioned, they can be great. They can look fantastic. They can dramatically change how a person's looks, how their face looks. And it can really make someone who's pretty look just beautiful. Like once you get all the harmony together that they need. So yeah, in the right patient with the right implant, the chin implant can be incredible.
Same with facelifts. This is another place where I think chin implants are underutilized because, man, does that chin projection really matter to the neck.
To the neck. Well, also because if you're in that facelift category, The chin is a very common place to lose bone as we age. The bone kind of resorbs and gets smaller all over your body, but also in the face. And very commonly you see it in a smaller chin. And so restoring it back to what it might have been in the youth is really helpful in getting sort of that overall facial rejuvenation that you're looking for. But I think that's a good segue to talk about the chin in combination with the neck, because they are literally connected, but they're very much connected in terms of your profile and how one can benefit or augment the other.
Yeah, and for sure, projecting that chin really helps with like platysma. Like you're going to actually take the insertion of the platysma forward when you do that, and it's, you know, it makes a big difference in terms of the look of the neck.
Yeah, if you really want to get that like defined angle, kind of that deep hollow. Some people have sort of a blunted angle below the chin. It's called like the submental angle, that where you go from your chin to your neck. Ideally should be sort of more of a right angle, and some people it's very blunted. And putting an implant in there can definitely sort of bring that out, as can all of the other things we do during a neck lift, such as the liposuction, the platysmoplasty, doing anything with the glands, anything that's going to sort of define that area.
Yeah. So I think it's always good to understand when your plastic surgeon says, hey, you know, maybe we should pop a chin implant in there. Then that's something to evaluate and think about, because it does make a difference. And it can be a standalone procedure too. I mean, I have people come in and say like, I need a chin implant. Like
That's
it's kind of
literally all they need. They just need a chin implant.
Yeah, this thing's too small. I mean, I've like it does wonders for people. It's a great operation. The downsides that people hear about, you know, they say that the alloplastic materials like silicone, these synthetics, can cause bone resorption, can cause it to remodel. There have been studies. It's never been clinically relevant, and I'm not sure that it causes bone to absorb, but I think it's actually osteoconductive. There have been a few of my patients that bone has grown completely over the chin implant. You know, they come back like 12 years later, they're like, you know, my chin seems to be getting bigger. Huh. And sure enough, they've grown bone, you know, just completely encased the silicone implant. Wow. And that's been more than one. I can think of two right now off the bat.
What do? You just chisel it out, chisel it all, burr it down.
You know, get a burr, zzz, you know, burr it down, make it look nice, and then put a new one in, and that seems to work. The you know, and for kind of completeness sake, the sliding genioplasty, where you cut the bone and move it forward and plate it. I like that operation. It is fairly straightforward. It's pretty simple. The downside is that I often feel and see step-offs.
Yeah, that crease, that mental crease that everybody has, can become a little more exaggerated after that.
It's not my favorite. I don't love it.
You know, the things people say about the sliding genioplasty is that it's a permanent solution, and people worry that if you have a chin implant, that, you know, like with a breast implant, do you have to swap it out every so many years, or is it literally permanent? Can you go, you know, to the grave with this thing?
I think you'd go to the grave with them. The only one I had to fix was that one that was getting bigger. You know, it's my patient from, I think she's from Long Beach, and she just said like, it looks a little strange, and you know, we got a CT and. Totally encased in bone.
Bizarre.
That happens. It's probably not clinically relevant in most cases. It was for her. But, you know, the sliding genioplasty is something that, you know, people who do that love it. It's easy. You know, if your surgeon says, hey, I want to do a sliding genioplasty, it's not the end of the world. It's very straightforward. You know, but the ease of putting in a chin implant is pretty real.
Yeah, it's pretty straightforward. It's a small incision, like you said, either inside the lip or right under the chin. Choose the right implant, you put it in place, close up, you go about your day. You know, a couple days to a week of some pain and discomfort, a little sore. Kind of got to eat some soft foods. Make sure you don't open your mouth too wide. But the recovery is, if that's all you're doing, is fairly straightforward.
Very straightforward.
And then you just go on with your life. I like doing it, like you said, with liposuction under the chin. I think that makes for a really great neckline, jawline. You can really define it once you remove any extra fat that might be under the chin, put that implant in to define it, and that's a game changer for a profile.
Yeah, and the complications, you can have a little weakness of the depressor anguli oris, the muscles that pull down the lip, and people always think like, oh, you know, what happened to my my lip. This one's pulling too much, and it's actually the opposite one that's been injured, and the lip is up too much. That only happens to people who absolutely shouldn't have it happen, like actors, like, people who really need to look normal next week.
They're getting their headshots done in 2 weeks. Yeah, that'll happen to that person.
They all heal. What I will tell you, though, is that I had one patient who had a little weakness afterwards, but when we looked back on the pre-op smiling photos, that weakness was there. Everybody's left side is a little bit weaker than the right. And I don't know what that's about. Don't know why. But even if you look at like my smile or your smile, when we smile big, there's weakness on the left side compared to the right. Who knows? That's just kind of a thing that you should notice. You should point out to the patient so that they can say like, oh.
But yeah, I mean, that is the one thing that could be disconcerting. And it's not that the nerve has been cut. It's been traumatized a little bit. So give it a few months, let some swelling go down, and it comes back and it's fine. In the meantime, you can always Botox the other side to similarly paralyze it for symmetry purposes. After a few months, it comes back.
Yeah, so I think that's, that's sort of, chin implants in a nutshell. It's pretty straightforward. The results are great. Love them. But it's all about selection, right patient, right device, right placement, and, then Bob's your uncle. You get a great result.
I couldn't agree more.
Well, in that case, Dr. Rovelo, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.